25-year-old Haley Bieber wrote on her Instagram a couple days ago that she suffered a stroke. Now, based off what she described, it sounds more like a TIA or a mini stroke, but we don't know the details of that. But I figured this is a good time to help educate young people on the risks of stroke. So we're talking about an ischemic stroke, which is when a small blood vessel basically gets occluded and you lack blood flow to a certain part of your brain, producing those stroke symptoms. If it's occluded for too long, the brain tissue will actually die, causing the stroke. If the occlusion gets relieved, then it's a mini stroke or a TIA. It's important to know about this stuff because basically every 40 seconds in the United States somebody has a stroke, and every 4 minutes somebody dies of a stroke. It's twice as common in Black patients as it is white patients, although anybody can be affected. And actually 10 to 15% of strokes occur in the age category 18 to 50, which in medicine we would consider pretty young. Although some medical conditions like hypertension, diabetes can raise the risk of stroke, we know that. There are some behavioral conditions that are also risk factors for stroke that people should be aware of. Things such as a bad diet, obesity, not enough physical activity, tobacco use, as well as too much alcohol. All of those things can be associated with a higher risk of stroke. We like patients to keep in mind the FAST acronym, which stands for facial droop, arm weakness, speech difficulties, time to call 911. Basically, if you have any of those signs and symptoms, call 911 right away. Other things you should really look out for: sudden numbness, severe headache, confusion, trouble walking, or trouble with your vision. If you have any of these signs or symptoms, you should call 911 right away, because with strokes, we like to say time is brain, meaning if you wait too long, brain tissue dies and you cannot recover that. But if you get to the ER quickly enough, usually within a couple of hours, we have a lot of treatments and things we can do that have a good chance of reversing the effects that you're feeling and avoiding long-term complications. So stay safe, watch out for those signs, and call 911.